Okay, I'm going to do a review of the cranial bones that we learned in lab this week, including the landmarks that you are responsible for, ones that we discussed in lab. To start off with, we're going to cover cranial bones. I'm going to do facial bones in a separate video. So our first cranial bone that we'll talk about is the frontal bone. So frontal bone is this bone right here. It's most anterior on the skull, and you've got one frontal bone. We have several landmarks that are important here. These two little tiny holes that are superior to the orbits are the supraorbital foramen, and an artery and a nerve travel through there, just like we've learned in a hole in any bone. Typically you have a structure that's going to travel through that hole. So that's supraorbital foramen. And then this kind of midline bony prominence in between the two orbits is the glabella. That's that landmark right there. We can turn the skull to the side and we can see parietal bone. Your skull has two parietal bones. So you've got a right parietal bone here. And then if we look on the other side, this would be our left parietal bone on this side. And they're going to meet in the middle. You can see their suture line in the middle. We're going to talk about sutures in a different video as well. We also have, if we look laterally, we've got the temporal bone, which is going to be this bone right here. So a left temporal bone and then right temporal bone on this side. Okay, so several landmarks on the temporal bone. The first of which we can talk about the mandibular fossa. So we can actually kind of disarticulate his jaw here, and you can see this kind of indented area here. This is the mandibular fossa, and this is the area that forms a joint with the condylar process of the mandible, the lower part of your jaw. Fits right in here perfectly and creates kind of a hinged joint to create your TMJ or your temporomandibular joint. We also have the zygomatic process, which is this area right here. So this is an extension of bony prominence from the temporal bone that's extending a little lateral and a little anteriorly to articulate with the zygomatic bone. It also forms part of your cheekbone there. If you look to the side here, or maybe even inferiorly, you can see these sharp processes. These are the styloid processes. And just posterior to those are the mastoid process. So this is a larger process. In fact, you can palpate this on yourself. It would be behind your ear. So if you come just posterior to your ear, you're going to palpate this bony prominence, and that serves as an attachment site for several muscles. That's mastoid process. Just anterior to mastoid process is external auditory meatus. And so this is basically your ear canal, your external ear canal that's going to lead from the external into your ear to the tympanic membrane or eardrum. Okay. If we look more internally, we can find internal auditory meatus on either side. Okay. And if we look from the inferior aspect of the skull, we can locate styloid process here and come just medial to the styloid process. You're going to find a larger opening, and that's going to be the jugular foramen. So this is a hole where the internal jugular vein travels, draining venous blood from the brain back down to the heart. And just anterior to the jugular foramen is the carotid canal. And that's going to be these little openings here. Your internal carotid artery travels up through those holes, taking arterial blood up to the brain. If we look at the skull on the posterior aspect, we can locate the occipital bone, which is going to be this bone here. Okay, you have one occipital bone and it's most posterior. Okay, a couple landmarks that we can identify on the occipital bone. This large hole on the inferior aspect of the skull is the foramen magnum. So large hole, foramen magnum, and this is where your spinal cord exits. On either side of the foramen magnum, you have these larger, prominent, kind of convex bony surfaces, and this serves as an articulation point with the first cervical vertebrae. Okay, these landmarks are called the occipital condyles. And then we can also look at the skull from the posterior aspect. I mean, you can find these two lines that kind of cross from side to side. The one on top is the superior nuchal line, and the one just below it is the inferior nuchal line. So these are raised, prominent areas of bone. They serve as attachment sites for ligaments and muscles. And then this area of this kind of very prominent area here, a little more prominent, this is the external occipital protuberance. Okay. Large area there too. Okay, then we can look on the inside of the skull. So we can take off the top of the skull, the calvaria or the skull cap, and we can peer down inside the skull, kind of a bird's eye view. And the bone that we want to look at in here is called the sphenoid bone. I call this the Batman bone. This bone kind of looks like a bat. So here's its wings on this side, and then it's going to have wings on this side as well. Okay, so this is more of an internal cranial bone. A couple landmarks here. You see this indented area right in the center. This is called the sella turcica, and that means Turkish saddle. This is the area the pituitary gland is located and sits perfectly right in that sella turcica. We also have, if you look a little anterior and lateral from the sella turcica, you can identify the optic canals or optic foramina, and your optic nerve travels through these holes from the eye and the orbit, traveling back to the brain. Okay. And then also as part of the sphenoid bone, we can identify the lesser wing, which is going to be this kind of more superior aspect here. And if we go just deep to that, we can identify the greater wing of the sphenoid bone. Okay. And then the last bone, as part of our cranium, is the ethmoid bone. And this bone is between the sphenoid bone that we were just talking about and the nasal bones, which are more anterior here. So this bone lies kind of deep right in between the two. It's an unusual shaped bone. We can identify a couple landmarks from this view. So one thing that we can find here, this area here that's more anterior in the skull, this is called the cribriform plate. And on your skulls you can see little tiny holes or indentions. Those are your olfactory foramina. And they serve as conduits for olfactory nerves going from your nose, from odor receptors in your nose to your brain. So that's what those little holes are for. You can also see this more pointed or sharp ridge of bone. That's part of your ethmoid bone. This is called your crista galli. And what that does, it's an attachment site for your dura mater, which is this thick covering that covers your brain, and it serves as an anchor point for that dura mater in the anterior part of your skull. We can also look at a couple more landmarks associated with the ethmoid bone. If we look anterior at the skull, we can find nasal cavity. And you can see the nasal cavity is divided into a left half and a right half by the septum. Okay, you kind of see this wall splitting the nasal cavity into two. The superior aspect of that nasal septum is formed by the perpendicular plate of the ethmoid bone. And then if you look just lateral to that, on either side, these bony prominences on the lateral aspect of the nasal cavity are called the middle nasal concha. And you can visualize those in the nasal cavity there.